one of the things that Imagineers are known for are sort of their big thinking, their blue sky meetings, where you can walk into a room and sort of ignore all of the current constraints. And as we know in healthcare, there are a lot of current constraints. There's lots of regulatory things. There's lots of history. This is the way we've always done things. And so how do you take that concept of, okay, let's just, think big, and you don't have to think within the box. You can certainly think outside of the box. That is, I think, an area that, for any industry, but in particular healthcare, would be really interesting to think like, okay, I know we've always done it this way, and I know there are reasons, but for now, let's just ignore that so we can sort of free our thinking to think outside the box and come up with innovative solutions.
Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello there. Today I'm so excited because we have a show like no other. We have the lovely Katie Baca-Motes here, and we're ready to talk about your journey to clinical research and digital health. Can you tell us a little bit about that?
Sure. Yes. I actually came into digital health and clinical research in kind of an unconventional route. So my undergrad was in biology and chemistry. I actually thought I was going to go the doctor route, but didn't at all. I ended up not going in that direction, and I ended up going into business instead. And in the course of that, I got very interested in behavioral science, behavioral economics, really trying to understand what motivates people to do the things that they do. And I was working at places like Disney, which, we got introduced through that and some of your great TED Talk. And then I got introduced to Dr. Eric Topol and Dr. Steve Steinhubel out of Scripps Research. Scripps Research is a nonprofit academic research center out of La Jolla, California, doing some great work. And I got brought in to do one of the very first direct-to-participant clinical trials. So outside of that traditional academic center, how do we reach out to people digitally? How do we engage them? How do we take them through electronic consent and, give them their information back and really engage them through the course of a clinical trial? And then when we wrapped that first study, we at Scripps Research got a grant to run the participant center for the All of Us Research Program, which is a 1 million-person cohort led out of the National Institutes of Health, looking at gathering multimodal data from people all across the United States to really fuel and accelerate biomedical research. And since then, we've taken that information and built several research platforms, some in maternal health and sleep medicine, and precision nutrition and COVID and influenza like illnesses were another big focus, obviously, over the last couple of years for the pandemic. I think we all shifted our focus to the pandemic and seeing what we can do around COVID and related research. So I'm one of the non-PhD clinicians that works at Scripps Research and on clinical research, but it's been really exciting to come in and bring a new element to it and really think about the participants and how we can engage.
I think that's a fascinating story, and it's really pertinent to our listeners because a lot of our listeners are pre-meds, and they're in that phase where they may be a biology or a chemistry major, and they're teetering with like, do I want to be a doctor? Do I want to go through the training? Do I want to do something else? And my advice to students, even though it may sound weird, like coming from a show where we're mentoring medical students, if there is anything that you can think about wanting to do before becoming a doctor, do that first and then come back if you still have that inkling, because there's so much out there and there's so many opportunities, especially for students who may not matriculate straight through, who may decide to go into another career path, who may need to take a break before taking their entrance exams. So there are opportunities out there and other ways in which you can contribute to healthcare. So it's very important to know your why, because this is a great point where a lot of students now are at the point where they're thinking about creating their personal statements or going to interviews. And a lot of times people's generic answer is kind of cliche, like I want to help people. But there are so many ways to help people without a stethoscope. So I'm excited to chat with you today.
Yeah, no, I love that. Know your why. And that relates to everything. I mean, that you do in the work world. That's great.
Absolutely. So, as you mentioned, prior to joining Scripps Research Digital Health Team, you were a Disney Imagineer. Now, this is near and dear to my heart and quite fascinating because, as you mentioned, and a lot of our listeners probably don't know, I recently did a TEDx talk on how we can transform healthcare using the Disney Imagineering concept called "Did Disney Just Save Healthcare? Imagine That." So, can you share with your audience what an Imagineer is and what your role was?
Yes, absolutely. And first of all, that's how I got introduced to you because I saw your great TEDx talk and loved the concept. So I had to reach out to you because we're in similar channels and tell you, hey, I was an Imagineer and I love the concept of you reimagining healthcare as an Imagineer. So for those folks who don't know Disney very well, or even if you do, but don't know Imagineering, Imagineers are really behind the magic. And so it's the folks who are in the back creating products, looking at animation, creating all of the great rides that you see at the amusement parks, all of the little special effects within like the Haunted Mansion or, Cars Land, or figuring out how to make hair move around, in a real life fashion for animation. So Imagineering is exactly what it sounds like. It's sort of the engineering, the design, the building, but with a touch of magic, with the imagination piece that really makes Disney magical. And I lucked out and I got to work there right after business school. And again, I was more on the behavioral science side of doing experimentation within the parks and the hotels, looking at how do we really engage with our guests and how do we make things magical, and while keeping the parks running. How do you manage, crowd control? How do you use messaging and incentives to get people across, from a busy area of the park to maybe a not so busy area of the park, so everybody has a better time? How do you engage with guests to provide or to start to engage in environmentally friendly behavior within the hotels so that we can, save our planet while we're having a good time and utilizing the resources at Disney? So I was involved in that for a little while. And back to your point, Erkeda, about, trying different things. My Disney experience was supposed to be a 3-month professional internship, and I ended up staying there for 3 years because I loved it so much and got to do so many neat things.
That's awesome. And it's so fascinating that there's so much thought in the behind the scenes components. And I'm sure that some of the things that you learned at Disney, you're now translating into your current work.
Mm-hmm.
So my question for you, since we kind of came together with the concept through my TEDx about Disney and how we can incorporate some of those ideas into healthcare, can you, since you've lived through it and experienced it, see any of the Imagineering concepts translate into healthcare?
Definitely. So as you mentioned in your TEDx talk, one of the things that Imagineers are known for are sort of their big thinking, their blue sky meetings, where you can walk into a room and sort of ignore all of the current constraints. And as we know in healthcare, there are a lot of current constraints. There's lots of regulatory things. There's lots of history. This is the way we've always done things. And so how do you take that concept of, okay, let's just, think big, and you don't have to think within the box. You can certainly think outside of the box. That is, I think, an area that, for any industry, but in particular healthcare, would be really interesting to think like, okay, I know we've always done it this way, and I know there are reasons, but for now, let's just ignore that so we can sort of free our thinking to think outside the box and come up with innovative solutions. The other aspect that I believe you mentioned, and I always loved about Disney, is you would pull in people from all sorts of different, areas. So I'd be walking down a hall, in Disney and, passing robots and passing, models and stuff. And I would be like called into a meeting like, hey, what, do you have a couple of minutes? And you would just pull in everybody that you could see and brainstorm about an idea, right? it's all about understanding different perspectives and really learning from different industries, different backgrounds. How can we approach this particular challenge and opportunity from multiple angles? I think you had mentioned learning things from, the checklist manifesto that came over from, how do pilots in flights go through and make sure, they've done their checklist, and then how do we incorporate that into healthcare? So those are some really interesting angles I think that we see. I'll stop there. I've got another more Disney, broader than Imagineers, but I'll stop there.
No, I love to hear it. You can keep talking. I think that you just bring a great perspective, because for those who have not listened to the talk, and we'll tag it onto this episode so you can click on it if you want to learn more about what we're talking about. But we have an opportunity to have an expanded version of interdisciplinary medicine in healthcare. Yes, we work on different teams where we may work with nurses or physician assistants or hospital administrators or engineers if you're working in digital health. But there are so many other people who can contribute to health through their work experiences or their life experiences. So we were mentioning, I know a lot of medical schools and the medical education focus on how we've adopted some of our ideals from the airline industry with pilots. But there are so many other industries that we can learn from to help revolutionize healthcare. And it's an exciting time for you guys because you're in the beginning of your medical careers where you can kind of think on these things and work on these things and jump on projects and help change the way that we experience healthcare as we know it.
Yeah, exactly. I mean, to be honest, when I got into clinical research, I had been doing, experimentation, right? So everything from Silicon Valley calls it, A/B testing, right? And when I came in and started working on recruitment and engagement for clinical research, I didn't know anything about recruiting a patient population of average age of 75. How do you engage them into doing clinical research? But I said, we're doing this by email. So why don't we just kind of look at all the different motivators, come up with some A/B testing on subject lines and email body and see what people actually respond to. Mm-hmm. We learned, what motivates a patient population. It wasn't what we thought, right? It was something new and novel that we uncovered in the course of experimentation. But just that experimentation, it was completely, you do that in marketing all the time, and you do that, in Silicon Valley, and you're always A/B testing and you're doing everything, but that was new to this element of clinical research. Even though clinical research is all about, figuring out what works, they weren't implementing that piece at the start, even though recruitment and retention is a big thing. And so we were able to innovate and continue to innovate that over time. So that's, it's nice to borrow, I would say, and sort of tweak from everything that you're seeing being successful in other industries.
Absolutely. And as you were mentioning, we're in a new digital age for clinical trials and research. So a lot of our students are looking for opportunities to explore research and to have papers published and to learn how things function. Some students may go down the avenue of getting a PhD. Some students may decide to work in clinical research instead of working with one-on-one patient care. So are there any ways that students can get involved with digital research with your organization or something like that? And how can they work on that?
Yeah, I think it's an exciting time in this space. Even with sort of the recent slowdowns, I think we had a huge acceleration of everything digital, telemedicine, everything in COVID, and now it's starting to calm down again a little bit. But I think this is a really exciting time for digital health in general, and also digital clinical research and digital trials. They can certainly get involved in any of our studies, looking at digitaltrials.scripps.edu, which I'll send you and we can post in the notes. We have platforms looking, like I mentioned, on precision nutrition. So we've got patients or participants, collecting tons of data on themselves so that we can look at individual glycemic response. So we're collecting stool samples and saliva and, a blood in the home to check HbA1c levels. And then we go through and they they track their continuous glucose monitor with a Dexcom device, and they track all their nutrition, and they have their Fitbit on so that they can, track activity and sleep. So there's some really innovative things that you can now do direct to participant in the home, which I think are super exciting. Scripps has, PhD programs. We have a lot of PhD clinicians, because a lot of people who go through that are still practicing, but they're really interested on the research side. So they wear the dual hat. A lot of them are PhDs, MDs, and they come in and they add a lot, of expertise and a lot of guidance as principal investigators of a lot of our studies. So there's lots of opportunities, before you go to med school, during med school, after med school, and lots, like you keep mentioning, lots of ways to influence in a positive way the health of, our patients, participants, families, communities.
This is such an exciting thing, because I know when I was in pre-med, and I won't date myself, we didn't have these opportunities for digital health and research and things. So this is definitely something that we'll put in the show notes. And for the students who may be looking for something to do during their summers or longitudinally, it's definitely something to look into.
Yeah, definitely.
So I love asking this question to my guests, and it'll be even more special because you're not a physician, but you're still involved in healthcare. So the U.S. healthcare system is not perfect, as I'm sure you've noticed. If you had a magic wand and could change anything about healthcare, what would it be?
That is a great question. So there are a lot of things wrong with the healthcare system. It's complex. There's misaligned incentives. There's things. But I think, and this is I was going to mention, so I'll come back to it. The other aspect I really like about Disney as a whole is the naming convention, right? So I was an Imagineer, and just by the name, you know what that means, right? You know that part of your job is to imagine big and to bring some magic. For those of you who don't know Disney well, they never, ever call anybody a customer, right? There are no customers at Disney. It's a guest, right? And so everybody knows what that means. It's a different mental model that you have of how you should treat your guests coming in. And the people who work in the parks and in the resorts, they're called cast members. And they know when you go from backstage to onstage, because it's backstage, and then you go through a little corridor and there's a mirror there, and you know you're on stage. And so anybody that you see working in Disney, whether it's management, Bob Iger, the CEO, people, sweeping up, the trash, everybody knows you're part of the show. And so if you see a piece of trash, or if you see a kid, drop some ice cream, you're empowered to do something about it, right? You're going to pick up trash and you're going to smile and everybody's happy. And you're going to get the kid a new ice cream. And you're able to do that, not because you have a checklist of 72 things that, you knew in the employee handbook of things you were supposed to do. It's just by calling people guests and just by calling people cast members that you automatically get that sense of, this is what I'm supposed to do. As a Disney cast member, I'm here to create the show and the magic. And so coming back to healthcare, and the thing that I would change, I've had the opportunity to work with Dr. Erkeda for the last 7 years at Scripps Research, which some of you may know. He's written 3 amazing books. His middle one is called The Patient Will See You Now. And I think that just changing from that, the doctor will see you now, to the patient will see you now, says everything. It means you are the patient. You are at the center. You own your own data. You're at the center of your care. Something like that, just changing that mental model of how we treat the physician-patient relationship, I think would be a nugget to really, start that thing. So I think with the magic wand, that's what I would do. I would change it and really make sure that, patients are at the center rather than, the healthcare profession, or, more cynically, the insurance and the payers and all of that are not at the center of healthcare, that it truly does come back to the people.
I love that. And that makes a big difference. It's kind of like figuring out clearly what your role is and how you can contribute and how you can change things, and then having those clear labels and those clear things okay, I am a part of this cast, this is my show, you're owning it. and being able to move forward. That just sounds amazing. So I really enjoyed talking with you today. And I just want to give you an opportunity to just say goodbye to our guests and let them know any ways they can reach out to you. And we can say that website again for research.
Okay, yes, absolutely. Well, it's been such a pleasure to talk with you. And like I said, I absolutely loved hearing your talk and your ideas around changing healthcare. And I'm excited that all of the students here are listening and trying to figure out what they want to do next. They can reach out to me. So my name is Katie Baca-Motes. You can find me on LinkedIn by just a quick name search. I use LinkedIn a lot these days. I'm still fairly active on Twitter, not as much as I used to be, but it's at Baca-Motes, all one word. So Baca-Motes is the handle. And then our website over at Scripps Research for the Digital Trials Center is digitaltrials.scripps.edu.
Thank you so much. And for all of the listeners out there, I hope that you gained some value from this. Definitely check out all the links. And you can also message us if you have any questions or any recommendations for any topics that you want to cover. Or if you're a student or a resident that wants to share your experience, you can always reach out to us at Med School Coach on Instagram or at DOCTOR, the letter D Graham, Dr. D Graham, me. And you'll get directly to us and we'll be able to figure it out. See you guys next week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.